Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, this is part 2. We're going to finish up benzos, the benzodiazepines, and then we're going to move into barbiturates. So guys, let's just jump in. A couple things to bring to your attention about the benzos. Very important. Look at this, adverse effect of benzodiazepine. When a benzodiazepine is inadvertently administered intra-arterially, okay, into that artery, arteriospasms may occur, which can ultimately lead to what? Gangrene, death of that tissue, which is going to have to be cut off, amputated. So what is this telling us? We do not ever give benzodiazepines how? Intra-arterially. Very good. Let me make this smaller. Okay. Again, when you're giving benzos, you're going to assess the patient to any allergies. You want to make sure they don't have kidney or liver impairment. In part 1, I talked to you about the importance of this, especially in the geriatric population, because guess what? If the liver's not working the way it's supposed to, patient's not going to be metabolizing these drugs the way they're supposed to. Drugs going to stay in their system longer. It puts them at risk for toxicity. And same thing with the kidneys. If the kidneys aren't working the way it's supposed to, the kidneys are not filtering out the blood. They're not filtering out these medications. Medications are going to stay in the patient's system longer, and they're going to be at risk for toxicity. Another thing, you're going to assess them for any condition that might be exacerbated by the depressive effects of benzodiazepines. Remember, benzos decrease everything. So anything else that will cause depression, we're going to assess this patient closely. Example, glaucoma, coma, psychosis, shock, acute alcohol intoxication, pregnancy and lactation. We talked about the effects on mom. You have actually on the fetus. So you have to explain the contraindications, what may happen, and mom has to make that decision if she still wants to take the medications. Assess for the following. You're going to be taking the patients, their blood pressure. You're going to check their pulse, respiration. You're going to check their skin. You're going to look at lab tests. Very important. Again, do not administer benzodiazepines intra-arterially. Do not do it. You can cause that patient to have gangrene. They could lose their extremity because of you. Do not mix IV drugs in solution with any other drugs. If you're giving that benzodiazepine IV, that needs to be the only drug that's going through that line. Give parental forms only if oral forms are not feasible or available. And as soon as you're able to give that benzodiazepine in a PO form, you're going to give it in a PO form. But remember, when you're giving this drug parentally, its effect, its strength is increased. Okay, so we always want to go from least to most. So as soon as you can give it PO, you're going to give it PO. Give IV drugs how? Slowly. Why? Because these agents have been associated with hypotension. You don't want to throw that patient into hypotensive crisis, mess around and make their kidneys and all of their other organs shut down and that patient go into shock. So we're going to give it slowly. Arrange to reduce the dose of narcotic analgesics and monitor closely patients. Why? Narcotics also depress the system, and so do benzodiazepines. So that makes sense, guys. You want to maintain patients who receive parental benzodiazepines in bed, because remember, when it's given parentally, it's much stronger. So patient has a higher risk of falling, of being dizzy, of having hypotension. So safety is definitely going to be an issue, guys. So if they're getting it parentally, we're going to make sure that we keep them in bed for periods of at least 3 hours. Do not allow them to walk. Do not permit ambulatory patients to operate motor vehicle after injection. Why? Because there may be confusion, they may be dizziness, they may be drowsiness. So that's not the time that they need to be driving around or operating heavy machinery. And again, we don't want them walking around in bed. We want them staying in bed for a good 3 hours. Look at this. This is on NCLEX. It's been seen on NCLEX. Make sure you know it. Taper dose how? Gradually after long-term therapy, especially in epileptic patients. You're going to provide comfort measures. You can read those comfort measures on your own. Environmental control. Remember, guys, what does this drug do? depresses that CNS system. So the lighting, you're going to make sure the lighting is nice and soft, not harsh, bright lighting. You're going to keep them away from stimuli. You're not going to have them next to the nurse's station where the nurses are giving report, the doctors are giving orders, family members of the patients are doing the most, everything's going on. No, you're going to have them at the end of the hall where it's nice and quiet, okay? Side rails up, bed in lowest position. You're going to make sure the call light is within reach, and tell them if they need to use the restroom to press that call button so you can help them. Under no circumstances are they to try to get up by themselves. All right, guys, those are your benzodiazepines in a nutshell. Make sure you go back and watch part 1 if you haven't done so already. Now I'm going to jump into our part 2, which is the barbiturates. So we're going to go over barbiturates used as anxiolytics, hypnotics. So barbiturates that are used as drugs to help decrease anxiety, right? So let's take a look at this. Barbiturates were once a sedative hypnotic drugs of choice. Not only is the likelihood of sedation, such as being drowsy, sleepy, right? Sedation and other adverse effects greater with these drugs than with newer sedative hypnotic drugs. But look at this. The risk of addiction and dependency is also greater. That has been seen on NCLEX too. I don't know why I didn't put a star next to it. And I don't have any pens. Nice. Let me see if this pencil works. All right, know it. It's been seen on NCLEX. It's very important for you to know. I'm sure we're going to see this again, okay? So for these reasons, when it comes to those barbiturates, newer anxiolytic drugs have replaced the barbiturates in most instances. Again, guys, it has those adverse effects of sedation, and people tend to abuse them. There's a risk of addiction and dependence, okay? So there are newer things on the market that we give because of this reason. The barbiturates used as anxiolytic hypnotics include the one I circled. You need to know this. This is the one that when NCLEX does tend to ask about this class of drugs, it's always the phenobarbital. Make sure you know it, okay? And then here are all the other ones. I don't write NCLEX, so make sure you know all of them. I'm just giving you little hints of what I see tend to show up. Now, therapeutic actions and indications. Barbiturates are general CNS what? Depressants. So they relax that CNS. Thus, they can cause sedation, hypnosis, anesthesia, and in extreme cases, coma. When it comes to CNS depressants, you can't get any worse than coma unless you're dead, right? All right. In general, barbiturates are indicated for the relief of the signs and symptoms of anxiety and for sedation, insomnia, pre-anesthesia, and the treatment of seizures. So those are the indications when we give barbiturates. Now let's look at these contraindications and cautions. Obviously, if the patient's allergic to barbiturates, we're not going to give, right? But look at this, a previous history of addiction to sedative hypnotic drugs. And like I said to you guys before, that is on NCLEX. I don't know how I missed that before, but I caught it this time. You absolutely need to know that patients tend to develop dependence to this class of drugs. That's why we use other things on the market, but you need to know this, okay? Other contraindications, latent or manifest porphyria. You guys know I can't pronounce. Porphyria, which may be exacerbated, marked hepatic impairment, nephritis, respiratory distress, respiratory dysfunction, pregnancy. Congenital abnormalities have been reported with barbiturate use. What does that tell us? That tells us that the patient should not be using this if they're pregnant or if they plan on getting pregnant, okay? Use with caution in patients with acute or chronic pain. Why? We don't want them to number one, we don't want them to start getting a dependence on them. But even important, when a patient has like acute pain and they take this type of medication, they get an opposite reaction. And if you watch part 2 in my video, I explained to you that opposite reaction, the opposite of what we would expect to see, or something that happens ironically, we would not expect it. What do we call that in the nursing world, in the medical world? Paradoxically, okay? So take a look, because barbiturates can paradoxically cause excitement. So instead of causing CNS depression, which is what we expect to see in barbiturates, this type of patient who has acute or chronic pain, it could cause CNS excitement, masking other symptoms. Also, we're not going to give this, or we're going to give it cautiously to any patient with seizure disorders, chronic hepatic, cardiac, respiratory disorders, and care should be taken to any woman who is, oh, sorry, you can't see that. Any woman who's breastfeeding because of the adverse effects on the infant, because it does cross through the breast milk. I have to be careful with my time here. Okay. All right, so adverse effects of barbiturates. As previously stated, the adverse effects caused by barbiturates are more severe than those associated with other newer sedative hypnotics. That's why we use the newer drugs on the market. However, NCLEX still asks about these, so you need to know them. For this reason, barbiturates are no longer considered the mainstay. When they say mainstay, they mean the treatment of choice, right? They're no longer considered the mainstay for the treatment of anxiety because we've got better stuff on the market. The most common adverse effects related to CNS depression, that's what you're going to see, you know, that sedation, that drowsiness, right? Somnolence, lethargy, ataxia, vertigo, that feeling of just having a hangover, okay? GI symptoms, nausea, vomiting, constipation, diarrhea, the basic ones you see for everything else. Associated cardiovascular effects, slowing down of that heart, which is your bradycardia. The decreased blood pressure, which is your hypotension. Remember, it decreases everything, guys. Serious hypoventilation. Well, that makes sense that a contraindication of barbiturates are people who have respiratory difficulties, because an adverse effect is hypoventilation. So why would we give a barbiturate that can cause a patient's breathing to severely decrease? Remember, your breathing is supposed to be 12 to 22 or 24, depending on the book you're using. Why would we give this to somebody who can possibly make their levels go lower than 12 when they already have breathing problems? Does that make any sense at all? No. So serious hypoventilation can occur in respiratory depression, and laryngospasms can occur, especially if it's given how? IV, intravenously. Hypersensitivity reactions include rash, serum sickness. Look at this. Stevens-Johnson syndrome. Professor D, is that on NCLEX? It's been seen on NCLEX many times. You better know it. This Stevens-Johnson syndrome, this is a potentially deadly skin condition, okay? Look at what it says, which is sometimes what? Fatal. So you absolutely need to know that about barbiturates. Drug-drug interactions for barbiturates. Increased CNS depression results if these agents are taken with other CNS depressants. That makes sense, such as alcohol. Yes, alcohol is a CNS depressant. I know that, you know, in the movies they show when people drink, they're partying, they have a good time, they're excited, but alcohol is actually a CNS depressant. It slows down your drinking. It slows down your thinking. It slows down your reaction time, the time that your brain tells your body to stop doing something. It's a depressant. Antihistamines and other tranquilizers. So if the patient takes any of these types of drugs, anything that depresses the system, and they take a barbiturate, it's going to further depress that CNS. There's often an altered response to phenytoin. That's your dilantin. This is important for us to know, guys, because dilantin is a very important medication that patients take for what? Seizures. And it's saying now, if the patient takes a barbiturate, they may be an altered response to this medication that the patient absolutely needs for seizures. You think that's important to know? Yes, it is. If barbiturates are combined with MAOIs, increased levels and effects can occur. Let me tell you something. You can't take anything with MAOIs. If you watch my pharmacology video I did about MAOIs, you know pretty much if a patient's taking MAOI, they can take that and that alone. You can't take anything else because there's always a reaction. So we don't want to take anything with MAOIs. It makes sense. In addition, because of an enzyme induction effect of barbiturates in the liver, the following drugs may not be as effective if desired. So if you take a barbiturate and you take any of these drugs that I have that you see down here, these drugs will not be as effective. And I highlighted not the most important ones because all of these are important, but the ones that NCLEX tends to ask you about, okay? Oral anticoagulants. That's important, guys. This keeps a patient from developing too many clots, having a stroke, thrombus, pulmonary, all types of things, right? So that if a patient's taking oral anticoagulants, this is needed. So we have to be careful because if they're taking a barbiturate, that oral anticoagulant may not work as well as it's supposed to, and they may develop a clot when we don't want them to. Digoxin. Digoxin is another important medication. We give this in lots of conditions, including CHF. Remember, digoxin is that drug that, you know, if the contractility was like this, right? And they take digoxin, all of a sudden, the contractility is like this, right? It increases that contractility of the heart to push all that blood, all that oxygenated blood out to the tissues. Even though it slows the heart rate, it increases contractility. Very important medication. If the patient's taking barbiturates, this medication doesn't work as well. That's important to know. TCAs, remember our tricyclic drugs for antidepressants. If you haven't seen my pharmacology video on that, make sure you watch it. Corticosteroids, those are important. You know, those decrease inflammation, right? By the way, corticosteroids, don't forget, 3 important things you got to watch out for corticosteroids is fractures, hyperglycemia, and infection. So if the patient's taking barbiturates and they're taking these steroids, the steroids won't work as much. And then your oral contraceptives. This woman will mess around and get pregnant when she didn't want to. So these are very important drugs or drug classes to know that will not be as effective if the patient is taking barbiturates. All right. So anyway, when patients taking barbiturates, we're thinking safety, safety, safety. So just as a reminder, let's talk about nursing considerations for patients taking barbiturates. Again, we're going to assess them for any allergies to barbiturates. For the 3rd time, we're seeing this. We need to remember it has a history of what? Addiction and dependence. NCLEX expects you to know this. Don't say Professor D didn't warn you. We're going to assess them for impaired hepatic or renal function or dysfunction, cardiac dysfunction, respiratory dysfunction, because we know it can cause respiratory hypoventilation, acute or chronic pain disorders, because remember it can cause what? A paradoxical effect. So instead of decreasing the CNS, if the patient has acute or chronic pain, it can actually cause CNS what? Excitation. Very good. We're going to watch out for pregnancy or lactation. Again, when it comes to the barbiturates, do not administer them arterially. Do not mix in an IV with any other drug. That needs to be the only drug in the line. If we have to give this medication IV, we have to give it parentally. As soon as it's possible to give it by mouth, that's what we're going to do. And how are we going to give this medication if we have to give it IV? Slowly. Because if you give it fast, you can cause that person to have heart issues, okay? We're going to taper that drug. If the patient has to be discontinued from that drug, we're going to taper it gradually. And that's across the board for all CNS medications. We're always going to taper them slowly. We don't stop abruptly. And key point, barbiturates are an older class of drugs used as anxiolytics, sedatives, and hypnotics. But again, we have better drugs on the market that we use now, but these drugs are still used a lot. So therefore, you guys need to know them. Guys, this is our, oh, you know what? Let me finish this up. and then I'll make another video because we're almost done. Hang on with me, guys. Let's talk about other anxiolytic and hypnotic drugs. This one you have to know. You absolutely have to know your antihistamine and your buspirone, but let's do that antihistamine first. So your antihistamines, and they give you the generic, make sure you know it. This is what's most important you have to know. Where am I? Okay, here, sorry guys, antihistamines. So they're used preoperatively as medications and post-op to decrease the need for narcotics. Because remember, yes, narcotics cause depression. Yes, narcotics are analgesics, they decrease pain, but they have addictive properties, okay? So we give antihistamines because remember, antihistamines have what type of effect? A sedating effect, okay? And the buspirone, this is another anti-anxiety agent. What do we love about buspirone? Look, it has no sedative, anticonvulsant, or muscle relaxant properties. Something else that's important to know about it, it reduces the signs and symptoms of anxiety without many of the CNS effects and severe adverse effects that we see with other anxiolytic drugs. So make sure you know your antihistamines, those drugs you see there, and your buspirone. All these other drugs, I'll just scroll down so you can take a look. I highlighted them, but there's really nothing I'm going to talk to you about. Now, guys, I don't write your nursing exams, so make sure you know all these drugs because I don't know what your instructor is going to give you. However, in my experience, these top two, they're the ones that you tend to be tested on the most. So make sure you know. Oh, here's the third one. Absolutely. Xalapon and your zolpidem. So, your zolpidem, that's your Ambien. This is given a lot. Anyway, both of these guys, they cause sedation and they're used for, here's your kicker, here's your key, short-term treatment of insomnia, never chronic. That is very important for you to know. And if NCLEX tends to ask you about it, this is what they're asking about. This is what they're trying to pull out of you. You need to understand that's only for short-term, not long-term. All right, summary very quickly. Again, anxiolytics, they treat anxiety by doing what to the CNS? Depressing them. Sedatives, they block awareness of and reaction to environmental stimuli. They cause drowsiness, a lethargy, and other CNS effects. Hypnotics further depress the CNS. They help induce sleep. Benzodiazepines are used as anxiolytics, but they cause drowsiness, lethargy, and other CNS effects. Barbiturates, remember those are older class drugs. We have newer things on the market that we give. Barbiturate drugs are used as anxiolytics, sedatives, and hypnotics. They're associated with potentially serious adverse effects, and they interact with many other drugs. They're less desirable than the benzodiazepine or other anxiolytics. Buspirone, and you see I put a happy face there, and other anxiolytic drugs do not cause sedation or muscle relaxation. That's why I put the happy face. We want that. And lastly, guys, our Xalapon and zolpidem, they affect melatonin levels, so they help to induce sleep. Very important. Do not forget, they're given for what? Short-term use.